Thank you for the invitations to speak here, and also it's a great pleasure to be here. And I really hope that this conference will be a start of something new. I mean, something that we have been hoping in Finland for a long time. What I would call a more intensive Nordic cooperation on the issue of homelessness. So I try to share my presentation. I think it's now visible. Just put the presentation mode. Yes. Now, now we can start. Just to give you a little bit about the big picture about the trend of homelessness in Finland. This is a long history, but it shows what has been the development of homelessness in Finland. It has been going down, and in the slide you will see also not only facts but also a little bit fiction, or at least the aims that we want to reach during the next years. And these are based on our government's decision to halve the existing homelessness by 2023 and to end it completely by 2027. And at the moment, the last count we had was at the end of last year. Now there's a count going on at the moment. But last year we had 4,600 single homeless persons and 220 families. And what's important is that over 70% of these people were living temporarily with friends and relatives. And this is quite much the group also that we have to concentrate in the future work. But there has been a significant change in the homelessness in Finland, as you can see, especially the long-term homelessness has been going down, and it means that we have been focusing on people sleeping rough and people living in shelters and hostels. So if I want to speak about Housing First 2.0, it means that there has been a Housing First 1.0 also. So it has been the national policy in Finland since 2008, when we started the program to reduce long-term homelessness and end it in Finland. And there were two big components in this program. The other one was the introduction or implementing of Housing First. As we understand it, it's a little bit homegrown model, as you may know. And also at the same time to make a systemic change so that we would reduce the share of temporary accommodation to an absolute minimum and base the housing on permanent housing. And this is quite natural because Housing First is relying on permanent housing. It's not working with temporary housing solutions. The basic principles are, I think, very well known for each of us. Housing first, housing as a basic human and social right, which means that you are given a flat of your own unconditionally, and then you will get the support that you need. So there are no preconditions. Housing is the foundation for your living, and the housing should be in normal surroundings, and it would be permanent homes. It means that it's based on rental contracts, rental lease, and normally for unlimited time. And in our model, the principle of autonomy and unconditionally are very important. And in relation to these principles, also the principle of normality. So it means that a former homeless person, when he gets a flat of his own or her own, he has the same rights and same obligations as everybody else in the same situation. And this concerns also for example, the economic support. So if you don't have enough income to pay your rent, you can get the general housing benefit as everybody else in the same situation. But the housing solutions in Finland, it's the main part is scattered housing, but also we have the supported housing units which have replaced the existing shelters and hostels. So as you can see from the numbers, they have been going down. So there are things that really have worked quite well. And I think that we have been very pragmatic when we have realized that ending homelessness means that we also have to provide the flats, the homes. And this has been quite successful in the cities that have been involved in the national programs. Permanent homes for over 5,000 people. And I would also say that one of the successes has been really the systemic change from a system that was based on shelters and hostels into a policy and strategy that's based on housing first and permanent housing. And it has been an integrated strategy also with elements of prevention. Prevention has meant for us two things: housing advisory services, which means that social workers work together with tenants with the aim to end or prevent evictions happening. And at the same time, the structural element of prevention, which is social housing, the level of new social housing supply has been rather good in recent years. Also, what has worked, although I would say that scattered housing is still the main option of housing solutions, the small supported housing units have worked quite well also. They are buildings where everybody has their own flats, but they also have common premises, and also there are on-site staff to provide support. And we have also seen the elements of a community building in these places, and also some forms of peer support, which has been very important. We have a long history in homelessness services and ending homelessness in Finland of a culture of collaboration. And one integral element of this collaboration has been the development network, which we have now as a more or less permanent structure in the Finnish homelessness system, which means that we have NGOs, people working on the front line, and then we have people from municipalities and even from ministries taking part together in this development network. And last but not least, the important inputs that we can get from experts by experience. And nowadays it's quite common also to have experts by experience, former homeless people working together in municipalities in developing the services. So if I would describe the Finnish homelessness system by a metaphor, let's imagine a building, a house. I would say that it has a very solid waterproof roof. And when you look it from a distance, it's a very nice looking building. But we realize that inside we have some unfinished business. There are a lot of renovation that needs to be done, to say nothing about the interior decoration, where I think, could even use some modern Danish design. So these are the things that have not worked so well. And I think that this is something where we are the best in the world listing problems. First, I would say that there's a risk of attitudes also. Because of the success we have had, there's a risk that you become self-satisfied with the situation and think that we have already solved the issue, which is not really the case yet. We have a lot of work to do. We still have a lack of small affordable flats. We have realized that there are more people that need more support. The basic model that we have had has been the intensive case management, and it has not always been intensive enough. There is a clear lack of integration of basic social and health services. and there's clearly insufficient supply of rehabilitation for drug abusers. This NIMBY that we had a project which was started in 2014, and we managed to start the building work actually this autumn. So it took around 6 years. The complaint process is started by the neighbors. So NIMBY is very much alive in Finland still. So there are a lot of problems that we also have in this system, in spite of all the success we have also reached. And for that reason, we started last year a process called a Change Laboratory. I was a little bit suspicious first because I thought that researchers do research, but in this case, we were very happy to have 2 researchers helping us in facilitating a process where we try to find the key issues that need to be developed. And actually, we had 3 different processes in this Change Laboratory. They did some interviews beforehand, and then we had 6 sessions where we had a very good conversations. There were 3 processes. One was in a Blue Ribbon supported housing unit in Helsinki. The other one was in the city of Tampere, and the third one was a national one, where we had around 30 participants from NGOs, cities, and also from ministries. And it was a very fruitful discussion because I would say that this process was probably much more democratic compared to the original process in 2008, which was in a very strong sense also top-down process. Now we had a democratic process where we could use the experience of the frontline workers and the experience that we had gained during this time when we started the new policy in Finland. Here are some facts about this Change Laboratory method and some links for you if you want to hear more about, read more about how it has been used in very different settings. In this process, we identified 6 spearheads. First of all, the availability of apartments, housing and services for clients with complex needs, work and meaningful activities, early identification and prevention of homelessness, integration of substance abuse, mental health, healthcare and housing services, inclusion of housing social work in the structures of municipalities. So these were the spearheads that we identified that are crucially important. I won't go into all the details, but something about this availability of apartments. We understood that so-called ARA apartments, which are social housing flats in Finland, they are the most important element in preventing homelessness, but it is also an important, or I would say the main route out of homelessness. And there's a process or contracts between the state and the big cities, which make it possible that you can specify city-specific targets for this. And now it's mainly 30%, which is the new share of ARA apartments in these MAL agreements. And also housing and services for clients with complex needs. Although we have made much progress with long-term homelessness, we still have a group of people, homeless people, who need very intensive support. And it seems that not in all municipalities, the understanding that the services should be based on housing first is self-evident. And for that reason, it's actually the procurement process where this is tested and where the municipalities have the possibility to make demands for service providers. Municipalities should take responsibility for providing or making sure that the services, the support services are adequate for people living in supported housing and in housing first flats. Also, housing and services for clients with complex needs, some other things that are important. And I think that one of the important conclusions was that understanding that housing is an issue that should be raised in almost all contacts that you have in social and health services. This is not always the case, that we sometimes make it too self-evident and we don't ask what's actually your housing condition, and especially when so many of our homeless people are living temporarily with friends and relatives, you really should make more questions about what kind of the actual housing situation is. And also, it's still the question that housing services for substance abuse treatment, we still have that kind of housing solutions that are conditional, and this is very much related to the homeless people who have substance abuse problems and whose housing has been based on this criteria. So there are a lot of things that needs to be done. We have now a new national program decided by our government, which aims to halve the existing homelessness. There are 11 biggest homelessness cities are involved, making the specific plans at the moment. And now the big thing is that how we can introduce these spearheads into these city-specific plans and these processes right now going on. But we already know that, for example, the social housing share will be increased from 25 to 30 in new housing areas. And there's also new efforts to get more financing for this support work, which has all the time been the critical thing. And this is something called impact investing. And this is now a process that we have started in Finland, but it will take a lot of time to make it a reality. Probably in 2022, we could start something like impact investing in Finland. Housing advisory services will be statutory in Finland. There's a process going on concerning the legislation. And also there's now project money to develop low threshold services and forms of support in scattered housing in the cities that are involved in this national program. Just to end my presentation, I would like to show an example of a new housing solution, which we call a hybrid model. It's in Järvenpää, where my foundation, together with Helsinki Diakonis Institute, we have a complex where we have supported housing first unit. There's a day center which can also be used by the neighborhood tenants. And there's normal affordable social rental flats. And also there are 20 satellite apartments scattered around in the city, which can get support from this unit. And as you can see, this is in the middle of other activities, so it's not a remote place. It has a quite good location in the context.